Alors, nous allons commencer avec le discours du
We will
ministre Anand. We'll start with
Minister
remarks from
Anand's.
Minister Anand.
Good morning, bonjour. Thank you for joining us. Last evening, in a conversation with representatives from Pfizer Canada, I was informed that due to work to expand its European manufacturing capacity, production of the Pfizer-BioNTech COVID-19 vaccine will be impacted for a short period. This expansion work means that Pfizer is temporarily reducing deliveries to all countries receiving vaccine manufactured at its European facility, and that includes Canada. Before discussing this further, I wish to be very clear from the outset. This is a temporary delay, and we remain on track to have enough approved vaccines for everyone who wishes to be vaccinated by the end of September 2021. Avant d'en parler plus longuement,
Before going further, I want to be very clear from the very beginning. This is a temporary delay and will have no impact on obtaining enough approved vaccine doses so that all those who wish to be vaccinated by the end of September will be able to get the doses.
Pfizer believes that by the end of March, it will be able to catch up such that we will be on track for the total committed doses for Q1. This is unfortunate. However, such delays and issues are to be expected when global supply chains are stretched well beyond their limits. It was with precisely these types of issues in mind that Canada pursued the aggressive procurement strategy that we did. Canada has in place 7 bilateral agreements with leading vaccine manufacturers and developers in order to ensure that we have diversity and flexibility when it comes to vaccine supply chains.
Canada has not only one of the most diverse vaccine portfolios in the world, we also have secured the largest number of doses per capita of any country in the world. This approach of ensuring diversity and volume months ago is what now gives us the flexibility and margins to remain on track in difficult times.
Canada has one of the most diverse vaccine portfolios in the world, and we have also secured the largest number of doses per capita of any country in the world. This approach of ensuring diversity and volume months ago is what now gives us flexibility and margins to remain on track in difficult times. I and my Department of Public Services and Procurement Canada remain in constant contact with Pfizer as well as our other suppliers. As I said earlier, this is a temporary situation and it does not impact our government's goal of having enough approved vaccines for every Canadian who wants to be vaccinated by the end of this coming September. Thank you. Merci. Miigwech.
Good morning, bonjour à toutes et à tous. So we'll provide an update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. Currently, there are almost 78,000 active cases in Canada, which is about 5,000 more active cases than a month ago. The total number of cumulative cases is now almost 689,000. Canada continues to monitor for virus variants that may be associated with an increased risk of spread. To date in Canada, there have been 23 cases with the B.1.1.17 variant first reported in the United Kingdom, and 2 cases with the 501Y.V2 variant first reported in South Africa. So slide 1. Oh, sorry. We'll let Dr. New do his French.
Bonjour à tous et à toutes.
Good morning.
Aujourd'hui, nous ferons le point sur les
Today,
travaux
we'll provide an
d'épidémiologie
update
et
on
de
the
modélisation
national
effectués au pays qui
epidemiology and
orientent
modeling
la
work
gestion actuelle
that
de la
informs the
COVID-19 au
ongoing
Canada.
management of COVID-19 in
Présentement,
Canada.
il y a près de
Currently, there
78
are
000
almost
cas actifs au Canada, soit
78,000
environ
active
5 000
cases
cas
in
actifs de
Canada,
plus
which
qu'il
is
y a
about
un mois.
5,000 more
Le
active
nombre
cases than a
total de
month
cas
ago.
cumulés est
During
près
the
de
same time period, the
689
total
000
number of
cas.
cumulative cases
Le Canada
increased
continue de
to almost
monitorer les variants du virus
689,000
qui pourraient être
cases.
associés à un
Canada
risque
continues
accru
to
de
monitor for virus
propagation.
variants that may
À
be
ce jour,
associated
au
with an
Canada,
increased
il y
risk
a
of
eu
spread.
23
To
cas
date, in
impliquant le
Canada, there
variant
have been
rapporté pour la
23
première
cases
fois
with the
au Royaume-Uni et 2 cas
variant
impliquant
first
le
reported
variant
in the United
rapporté pour la
Kingdom and
première fois
2
en
cases
Afrique du
with the
Sud.
variant first reported in South
Slide
Africa.
1. So the daily case count continues to far exceed the peak of the first wave, and early signs of leveling off for most of December have been replaced by a sharp rise in cases in late December following the holidays. On average, over 7,600 cases are being reported daily. Unless public health measures are further intensified, we will not be able to sufficiently suppress the current rate of epidemic growth.
Diapositive 1. Le nombre de cas quotidiens
Slide
actuels
1.
continue de dépasser de beaucoup le pic de
Daily
la
case
première
counts
vague et les premiers
continue
signes
to
de
far exceed the
stabilisation
peak of the
durant la
first
majeure
wave, and
partie
early
du mois
signs of
de
leveling off
décembre
for most
ont
of
été
December
remplacés par
have
une
been
forte
replaced by a
augmentation
sharp
des cas à la fin
rise in
décembre,
cases in
tout
late
juste
December
après les vacances des fêtes.
following the
En
holidays.
moyenne, plus de
On average,
7 600
over
cas sont rapportés
7,600
chaque
cases
jour.
are being reported
Si les
daily.
mesures de santé publique ne sont pas
Unless public health
intensifiées,
measures are
nous ne
further
serons pas en mesure de
intensified, we will
freiner
not be able to
suffisamment le
sufficiently
taux actuel
suppress
de
the
croissance
current rate
épidémique.
of epidemic growth.
Slide 2. The ongoing rapid growth of the epidemic in Canada is driven by continuing high incidence in provinces west of the Atlantic region, particularly in Canada's most populous provinces, Ontario and Quebec. Many provinces, including those that had been on a downward trajectory, like BC, Alberta, and Saskatchewan, saw a sharp rise in daily case numbers after the holidays. This is likely due to a combination of people having more contacts over the holidays and somewhat reduced health seeking and testing during those weeks. Before and since the holidays, community-level public health measures have been strengthened across Canada, with some areas showing that early, strong, and consistent public health measures is what works best to slow growth, maintain low levels of activity, or eliminate transmission from an area. However, we have yet to see the kind of widespread and sustained declines in daily case counts that would indicate we are bringing the pandemic under control nationally.
Diapositive 2. La
Slide 2.
croissance rapide actuelle de
Ongoing
l'épidémie au
rapid
Canada
growth of the
continue d'être
epidemic in Canada
principalement
is
due à une
being
incidence
heavily
élevée
driven
d'infections dans les 6
by
provinces à
continuing
l'ouest de la
high
région
incidence
atlantique,
in
et
provinces
tout
west of the Atlantic region,
particulièrement par les
particularly
provinces les
in
plus peuplées
Canada's
du
most
pays,
populous
soit
provinces,
l'Ontario et le Québec.
Ontario and Quebec.
Plusieurs provinces, incluant
Many
celles qui
provinces,
étaient sur une
including those that
trajectoire
have been on a
descendante,
downward
comme la
trajectory,
Colombie-Britannique,
like
l'Alberta et le
BC,
Saskatchewan,
Alberta,
ont
and
vu une forte
Saskatchewan,
augmentation des cas
saw a
après le
sharp
congé
rise
des
in
fêtes.
daily case
Ceci
counts
est
after the
probablement
holidays.
lié à une
This is
combinaison
likely
du fait
due
que les personnes ont
to a
eu plus
combination
de
of people
contacts pendant
having
le
more
congé des
contacts over
fêtes
the
et de
holidays
recours moins grand
and
aux
somewhat
consultations
reduced
et aux
health
tests.
seeking and testing
Avant le
during
congé
those
des fêtes
weeks.
et depuis lors, les
Before
mesures de santé
and
publique
since
au
the
niveau
holidays,
communautaire ont
community-level
été
public health
renforcées dans tout
measures
le
have been
pays et
strengthened
certaines
across
régions
Canada,
ont montré
with
que les
some
mesures de
areas
santé
showing
publique
that
rapidement mises en
early,
place, fortes et
strong
cohérentes
and
sont celles qui
consistent
fonctionnent
public
le mieux
health
pour
measures is
ralentir
what
la
works
croissance,
best to slow the
maintenir de
growth,
faibles niveaux
maintain low
d'activité
levels of
ou
activity,
d'éliminer la
or
transmission
eliminate
dans une région.
transmission from an area.
Toutefois, nous n'avons pas
However,
encore
we have
constaté
yet
de type de
to
baisse
see the kind of
généralisée
widespread
et
and
soutenue
sustained
du
declines
nombre
in
de cas
daily case
quotidiens
counts that
qui
would
indiquerait
indicate we
que
are
nous
bringing the
maîtrisons la
pandemic
pandémie à
under
l'échelle
control
nationale.
nationally.
Slide 3. Since the last modeling update, the number of health regions reporting over 100 cases per 100,000 population, the darker blue areas, has increased from 49 to 59 as rapid growth continues to expand into more areas. Over the past 2 weeks, a number of large urban centers, as well as some rural and remote communities, are reporting infection rates above 100 cases per 100,000 population. Some Atlantic provinces have been able to sustain sufficient measures to interrupt spread and maintain strong control of COVID-19. However, more recently, New Brunswick had a record high number of weekly cases, highlighting the challenges and setbacks associated with easing restrictions. In Nunavut, a 2-week territory-wide restriction period in November was successful in eliminating community transmission in areas of the territory affected by an importation case and sharp spike in locally acquired cases.
Diapositive 3.
Slide
Depuis la
3.
dernière mise à jour de la modélisation, le
Since
nombre
the
de
last
régions
modeling
sanitaires
update,
signalant
the
plus
number
de
of
100
health
cas
regions
pour 100
reporting
000
over 100
habitants, ce sont
cases
les
per
régions
100,000
foncé, est
population,
passé
the
de
dark blue
49 à
areas,
59,
has increased
la
from
croissance
49
rapide
to 59
s'étendant à un
as
nombre accru
rapid
de
growth
régions.
continues to
Dans les 2
expand into
dernières
more
semaines, un
areas.
certain nombre de grands
Over the
centres
past 2
urbains,
weeks,
et même
a
que
number
certaines
of large
communautés
urban centers,
rurales ou
as
éloignées
well as
ont
some
rapporté
rural
des
and
taux
remote
au-delà de
communities,
100
are
pour 100
reporting
000
infection rates
personnes
above
dans les 2
100
dernières
cases per
semaines.
100,000
Certaines
population.
provinces de l'Atlantique ont pu
Some Atlantic
maintenir une
provinces
série de
have been
mesures de
able to
santé
sustain
publique
sufficient
suffisantes
measures
pour
to interrupt
interrompre la
spread and
propagation et
maintain strong
contrôler
control of
rigoureusement la
COVID-19.
COVID-19.
However,
Toutefois, tout récemment,
more
le
recently,
Nouveau-Brunswick a
New
enregistré
Brunswick
un nombre record de cas
has had a record high
hebdomadaires,
number of weekly
mettant en
cases,
évidence les défis et les
highlighting the
conséquences
challenges and
associées à
setbacks
l'assouplissement des
associated with
restrictions.
easing
Au Nunavut,
restrictions.
une période de
In
restriction
Nunavut,
de 2
a
semaines appliquée
2-week
sur l'ensemble des
territory-wide
territoires en
restriction
novembre
period in
a permis
November
d'éliminer
was
la transmission
successful in
communautaire dans
eliminating
les zones
community
touchées par un cas
transmission in areas of the
d'importation et une
territory
forte hausse de
affected
cas
by an
d'acquisition
importation
locale.
case and sharp spike in locally acquired cases.
Across Canada, the incidence of COVID-19 has been consistently high in all age groups for many weeks. However, incidence is highest and continuing to escalate among persons 80 years and older who are at a high risk of severe outcomes, including death.
Diapositive 4.
Slide 4.
D'un bout à l'autre du Canada,
Across Canada,
l'incidence de la
incidence
COVID-19
of
a été élevée,
COVID-19
et ce,
has
de
been
manière
consistently
constante dans
high
tous les
in
groupes
all
d'âge
age
depuis
groups
plusieurs semaines.
for many weeks.
Cependant,
However,
l'incidence est plus forte
incidence
et en
is highest
augmentation
and
constante
continuing to
chez les
escalate
personnes de
among
80 ans
adults
et
80
plus,
years
qui
and
sont à risque
older
élevé d'issues
who
de
are
santé
at
majeures,
high risk
incluant
for severe
le décès.
outcomes, including death.
Slide 5. Ongoing high rates of infection in communities continuously leads to new infections, more and larger outbreaks, including in high-risk settings, such as hospitals, long-term care homes, correctional facilities, and shelters, where spread is further amplified in these closed settings. As community transmission further intensifies with sustained high rates of infection, there have been an increased number of outbreaks in long-term care facilities, ranging in size from a few cases to over 100. This is a difficult cycle of spread that can't be managed through outbreak response alone. Bringing infection rates down to stop the spread into high-risk settings requires individual and public health authorities working together.
Diapositive 5. Les
Slide
taux
5.
d'infection constamment
Ongoing
élevés
high
dans les
rates of
communautés
infection in
mènent
communities
continuellement à des nouvelles
continuously
infections,
leads to
à
new
des éclosions
infections,
plus nombreuses
more
et
and
plus
larger
importantes,
outbreaks,
notamment dans les
including
milieux
in
à haut
high-risk
risque tels que
settings
les hôpitaux,
such as
les
hospitals,
établissements de soins de longue
long-term
durée,
care
les
facilities,
établissements
correctional
correctionnels et les
facilities,
refuges,
and
des espaces
shelters,
fermés où
where
la
spread is
propagation est
further
encore
amplified
plus
in
amplifiée.
these closed
Étant donné
settings.
la transmission
As
communautaire qui s'est
community transmission
intensifiée
further
et qui atteint des
intensifies
hauts
with
taux
sustained high
d'infection,
rates
il y
of
a eu une
infection,
augmentation de nombre
there have been
d'éclosions
an
dans les
increasing number
établissements de
of
soins de longue
outbreaks in
durée,
long-term care
allant de
facilities,
quelques cas à plus d'une
ranging
centaine
in
de cas.
size from a few
C'est un
cases
cycle
to
de
over
transmission
100 cases.
complexe
This is
qui
a
ne peut
difficult
être
cycle
géré
of
par une
spread
seule
that can't be
réponse aux
managed through
éclosions.
outbreak response
Réduire les
alone.
taux d'infection pour
Bringing
arrêter
infection
la
rates down to
propagation dans
stop
les
the
milieux
spread
à
into
haut
high-risk
risque
settings
nécessite que
requires
les individus
individual
et les autorités
and
de
public
santé
health
publique
authorities
travaillent
working
ensemble.
together.
Slide 6. Hospitalizations have been steadily increasing since late October. Over the past week, an average of over 4,700 people with COVID-19 were being treated in Canadian hospitals on any given day, including 875 of whom were in ICUs. On average, the length of stay for people hospitalized is about 16 days, or about 20 days for those experiencing more severe illness. Increasing demands on the healthcare system is straining capacity and leaving the health workforce exhausted in many areas of the country. If the growth in cases continue at the current rate in heavily impacted areas, the ability to continue with the present level of elective procedures will become increasingly difficult.
Diapositive 6. Les
Slide 6.
hospitalisations sont en augmentation
Hospitalizations have been
constante depuis
steadily
la fin
increasing
octobre.
since late
Au
October.
cours de la dernière semaine,
Over the past
en moyenne,
week,
plus de
an average of
4700
over
personnes infectées par
4,700
la
people
COVID-19
with
ont été traitées
COVID-19
chaque
were
jour
being
dans les
treated in
hôpitaux
Canadian
canadiens,
hospitals
dont
on
plus
any
de
given day,
875
including
sont aux soins
875
intensifs.
of whom
En
were in
moyenne, la durée de
ICUs.
séjour des
On
personnes
average, the
hospitalisées
length of
pour la
stay for people
COVID-19 est
hospitalized for
d'environ 16
COVID-19
jours
is of
ou
about
d'environ
16
20
days,
jours pour les
or
personnes
about
souffrant
20
d'une
days
forme
for those
sévère.
experiencing more
La
severe
demande accrue
illness.
au système de santé met de la
Increasing
pression
demands on the
sur les
healthcare
ressources
system
avec
is
un
straining
personnel de santé à
capacity
bout
and
dans
leaving the
plusieurs
health
régions
workforce
du pays.
exhausted in many
Si
areas
la
of the
croissance
country.
de cas se
If
poursuit
the
à un
growth
rythme
in
actuel
cases
dans les régions
continue at
fortement
the current
touchées,
rate in heavily
la
impacted
capacité de
areas,
continuer
the
au niveau
ability to
actuel
continue with the
des
present
procédures
level of elective
électives
procedures will
deviendra
become
de plus en
increasingly
plus difficile.
difficult.
Slide 7. Deaths are the late indicators of COVID-19 severity and lag behind increases in reported cases by several weeks. Over the past 7 days, an average of 137 deaths have been reported daily. Those age 80 years account for 71% of all deaths, and those aged 60 to 79 years accounting for 26%. A majority of deaths continue to be linked to outbreaks in long-term care homes. People of any age can experience severe or prolonged illness due to COVID-19. Today, 70 deaths have been reported in adults 20 to 39 years of age.
Diapositive 7. Les
Slide
décès
7.
constituent
Deaths
des indicateurs
are
tardifs de la
late
gravité de la
indicators of
COVID-19
COVID-19
qui peuvent
severity
survenir plusieurs
and
semaines
lag
après
behind
l'augmentation du nombre de
behind
cas
increases in
déclarés.
reported cases
Au cours
by
des
several
derniers
weeks.
7 jours,
Over the past
137
7
décès ont
days,
été
an average of
en moyenne été
137
signalés
deaths
chaque jour.
have been
Les
reported
personnes âgées
daily.
de 80 ans
Those
et
aged
plus
80 years
représentent
accounting for
71% des décès
71%
liés à
of
la
all deaths,
COVID-19,
and those aged
tandis que
60
ceux
to
âgés de
79
60 à 79
years
en représentent 26%.
account for
La majorité
26%.
des décès continuent d'être
A
reliés
majority
aux
of deaths
éclosions dans les
continue to
centres
be
de soins
linked
de
to
longue durée.
outbreaks in long-term
Les
care
personnes de
homes.
tout âge peuvent souffrir
People
de
of any
maladies
age
graves
can
ou
experience severe or
prolongées
prolonged
dues à la
illness due
COVID-19
to
et à date,
COVID-19.
70
To
décès
date, 70
ont été
deaths have been
signalés chez
reported
des
in
adultes
adults
de 20
20
à
to
39 ans.
39 years of age.
Based on Canadian data up to January the 9th, short-term forecasting shows the predicted cases and deaths due to COVID-19 out to January the 24th. Short-term models continue to be accurate in predicting the growth trajectory. The graph on the left shows the predicted number of cases could be in the range of 752,400 to 796,630 by January the 24th. The graph on the right shows the predicted number of deaths could be in the range of 18,570 to 19,630 by January the 24th.
Diapositive 8. Sur la
Slide
base des
8.
données canadiennes
Based
en
on
date du
Canadian
9
data
janvier,
up to
les
January 9,
prévisions à court terme
short-term
fournissent le nombre prévu
forecasting
de cas et
shows
de
the
décès
predicted
dus au
cases and
COVID-19
deaths due to
jusqu'au 24
COVID-19
janvier.
out to
Les
January
modèles à court terme
24th.
continuent de
Short-term
fournir une
models
prévision
continue to
juste
be
de la
accurate in
trajectoire de
predicting
croissance.
the
Le
growth
graphique de
trajectory.
gauche montre que le
The
nombre
graph
de
on the
cas
left
prévus
shows the
pourrait se
predicted number
situer
of
entre
cases could be in the range of
752 400 et
752,400 to
796 630 d'ici le 24
796,630
janvier.
by January
Le graphique
24th.
de droite montre
The
que
graph
le
on the
nombre de
right shows
décès
the
prévus
predicted
pourrait se situer
number
entre
of deaths
18
could be in the range of
570 et
18,570
19
to
630 d'ici
19,630
le
by
24
January
janvier.
24th.
This long-range forecast shows how the epidemic could evolve over the next 2 months. We are forecast to have 10,000 cases daily by the end of January, with increasing hospitalizations and deaths expected to continue to follow the rising case numbers. Bending the curve of this resurgence, the blue line trajectory, requires urgent, consistent, strong, and combined efforts of individuals and local authorities. For all of us, that means we must maintain physical distancing, reduce contacts outside of our household to just essential activities, continue with good hand-washing practices, and wear face masks to protect ourselves and others. For local authorities, particularly where the virus is surging. This means that immediate implementation of strong restrictions, closures, and control measures is required to achieve the reductions in contacts necessary to arrest climbing numbers. As we've been saying all along, if we ease measures too soon, the epidemic will resurge even stronger. This is why measures need to be consistent and sustained long enough to sufficiently suppress epidemic growth to allow for lasting control.
Diapositive 9. Ces
Slide
prédictions à
9.
plus long terme
This
montrent
longer-range
l'évolution
forecast
possible de
shows how
l'épidémie au
the
Canada
epidemic could
au cours
evolve
des
over
2
the
prochains
next
mois.
2 months.
Le nombre de cas quotidiens prévus
We are
d'ici
forecast
la
to
fin de
have
janvier
10,000
est de 10
cases
000 cas,
daily by
avec
end
une
of
augmentation
January,
des
with
hospitalisations
increasing
et décès
hospitalizations
attendus
and
qui
deaths
continueraient
expected to
à la
continue
suite de
to
la hausse du
follow
nombre
the
de cas,
rising case
à moins que
numbers,
des réductions
unless immediate
immédiates
and
et
significant
significatives de taux
reductions
de
in contact
contact
rates
soient
are
observés.
achieved.
L'aplatissement de cette courbe de
Bending the
résurgence,
curve
la
of this
trajectoire de la ligne
resurgence,
bleue,
blue line
nécessite
trajectory,
des
requires
efforts
urgent,
combinés,
consistent,
immédiats,
strong, and
constants et
combined
importants
efforts of
de la part des
individual
Canadiens
Canadians
et des
and
autorités
local
locales.
authorities.
Pour nous tous, cela
For all of
signifie que
us,
nous
that
continuons à
means we must
maintenir une
maintain
distance
physical
physique,
distancing,
à réduire nos
reduce
contacts en dehors
contacts
de notre
outside of our
foyer aux
household
seules
to
activités
just essential
essentielles
activities.
et bien se laver les mains
Continue
et
with
à
good
porter le masque
hand-washing
pour nous
practices
protéger
and wear a
pour
face
protéger
mask
les
to
autres.
protect ourselves
Pour
and
les
others.
autorités locales,
For
en
local authorities,
particulier là où le
particularly
virus
where the
augmente,
virus is
cela
surging,
signifie que la
this
mise en
means that
œuvre
immediate
immédiate
implementation
de
of
fortes
strong
restrictions,
restrictions,
fermetures, de
closures,
mesures de
and
contrôle
control
est
measures
nécessaire
is
pour
required
obtenir
to
les
achieve the
réductions de
reductions in
contacts
contacts
nécessaires pour
necessary
stopper la
to
hausse des
arrest
chiffres.
climbing numbers.
Comme nous l'avons toujours
As
dit,
we've been
si
saying
nous
all along,
assouplissons les
if we
mesures
ease
trop
measures
tôt,
too soon,
l'épidémie
the
ressurgira
epidemic
encore
will
plus fort.
resurge even
C'est pourquoi les
more
mesures doivent
strongly.
être
This
cohérentes
is why
et
measures need to
maintenues
be
assez
consistent
longtemps
and
pour réduire
sustained long
suffisamment
enough
la
to
croissance
sufficiently
épidémique
suppress
pour
epidemic growth
permettre un
to
contrôle
allow for
durable.
lasting control.
The experiences of other countries also show us the challenges that still lie ahead and why we need early, strong, and sustained action to stop surges and keep COVID activity low. France experienced a very large resurgence in the fall. They implemented strong measures in late October, aiming to drive new infections down from 50,000 a day to 5,000 to maintain critical care capacity. After easing restrictions over the holidays, cases have started rising again, and stronger measures, including a nationwide curfew, are to take effect this weekend. Germany implemented stronger public health measures than they have ever used in mid-December, which kept case counts from increasing over the holiday period and increased them further after a small post-holiday surge to limit their epidemic growth. As the United Kingdom and Ireland eased public health measures, increased social activity over the holiday period, together with emergence of a more transmissible virus variant, contributes to the largest surge in cases yet. New, strong public health measures were needed to quickly suppress epidemic activity and preserve critical care capacity.
Diapositive 10. Les expériences
Slide
d'autres
10.
pays nous
The
montrent
experiences
également
of
les
other
défis
countries
qui nous
also show
attendent
us the
encore et
challenges that
pourquoi nous
still
avons
lie
besoin
ahead and
d'une
why we
action
need early,
précoce,
strong,
forte
and
et
sustained
soutenue
action to
pour
stop
arrêter les
surges and
résurgences
keep
et maintenir l'activité COVID à un
COVID
faible niveau.
activity low.
La France a connu
France
une très forte
experienced a
résurgence
very
à
large
l'automne.
resurgence in
Ils ont
the
mis en
fall.
œuvre des
They
mesures fortes à la
implemented
fin
strong
octobre
measures in late
visant à
October,
réduire les
aiming
nouvelles
to
infections
drive
de
new
50 000
infections
par jour
down
et
from
à 5 000
50,000
par jour
daily to
afin de
5,000
maintenir la
daily
capacité
to
des soins
maintain critical
intensifs.
care capacity.
Après avoir assoupli les
After
restrictions
easing
pendant les
restrictions over the
périodes des fêtes,
holidays,
les cas ont
cases have
recommencé
started
à
rising
augmenter
again,
et des mesures
and
plus
stronger
strictes,
measures,
y compris un
including a
couvre-feu à
nationwide
l'échelle nationale,
curfew,
doivent entrer en
are to
vigueur
take
ce
effect
week-end.
this weekend.
À la mi-décembre, l'Allemagne a mis en œuvre
Germany
des
implemented
mesures de
stronger
santé
public
publique plus
health
fortes
measures than
que
they
tout ce qui
have ever
avait été
used in
utilisé
mid-December,
auparavant
which kept
pour
cases,
empêcher le
case
nombre de
counts
cas
from
d'augmenter
increasing
pendant
over the
la
holiday
période des
period
fêtes.
and
Et
increased
les a encore
them
augmentés
further
après une petite
after a
poussée
small
post-vacances afin de
post-holiday
limiter la
surge
croissance de
to limit
l'épidémie.
their epidemic
Le
growth.
Royaume-Uni et l'Irlande
as
ont
the
assoupli les
United
mesures de
Kingdom
santé
and
publique
Ireland eased
début
public health
décembre.
measures,
Cependant,
increased
une activité
social
accrue pendant la
activity
période des
over the
vacances,
holiday
y
period,
compris l'émergence d'une
together with
variante
the
du virus
emergence
plus
of a more
transmissible,
transmissible
a
virus
contribué à la plus
variant,
forte augmentation
contributed
de
to
cas
the
à
largest
ce jour.
surge in cases yet.
De nouvelles mesures de santé
New,
publique
strong
rigoureuses
public
ont
health
été
measures
nécessaires
were
pour
needed to
supprimer
quickly
rapidement
suppress
l'activité
epidemic
épidémique
activity
et préserver
and
la
preserve
capacité des soins
critical care
intensifs.
capacity.
The arrival and initial rollout of safe and effective COVID-19 vaccines is a beacon of hope. But first, we need to flatten the curve once again, while vaccine rollout begins for priority populations. Everyone needs to follow local public health advice and reduce non-essential activities and outings to a minimum. Resurgence of COVID-19 activity is happening in many parts of the world, including the appearance of variants of concern that may spread more easily. For this reason, non-essential travel outside of Canada needs to be avoided, and all travelers coming into Canada must observe the 14-day quarantine to protect family and community. The next months will be hard as we work together to bring COVID activity under control to a level that will enable public health to test, trace, and isolate quickly and effectively. Our healthcare system is currently stretched, and health workers are exhausted, so they need our support. As vaccine supply increases, COVID-19 vaccine implementation will be one of the most complex undertakings in the history of public health. We know that Canadians are tired and that the winter months will be very challenging as we continue to grapple with high rates of infection in many areas of the country. Often, the end of the race is the hardest part, but it won't last forever. For now, we must redouble our efforts at this pivotal moment and get this done. Thank you.
Diapositive 11.
Slide
L'arrivée et le
11.
début de déploiement
The
de vaccins
arrival
contre
and
la
initial
COVID-19
rollout of safe and
sûre et
effective
efficace est une lueur
COVID-19
d'espoir.
vaccines
Mais
is a
d'abord, nous
beacon
devons
of hope.
aplatir à
But
nouveau la
first,
courbe
we need to
alors
flatten
que
the
le
curve
déploiement du
once
vaccin
again,
commence pour
while
les
vaccine
populations
rollout begins
prioritaires.
for priority
Tout le monde doit
populations.
suivre les conseils de
Everyone
santé
needs to
publique
follow
locaux et
local
réduire
public
au
health
minimum
advice
ses
and reduce
activités et
non-essential
sorties non
activities and
essentielles.
outings to a minimum.
La résurgence de l'activité de la
Resurgence
COVID-19
of
est observée
COVID-19
dans de
activity
nombreuses
is
régions du
happening
monde,
in many parts of
incluant
the world,
l'apparition des variants
including the
préoccupants qui
appearance
peuvent
of
se
variants
propager
of
plus
concern
facilement.
that may spread more
Pour cette
easily.
raison, les voyages non
For this
essentiels
reason,
à
non-essential
l'extérieur
travel
du
outside of
Canada
Canada
doivent
needs
être
to be avoided,
évités et tous
and
les
all
voyageurs qui
travelers
arrivent au
coming into
Canada
Canada
doivent observer
must
une
observe
quarantaine de
14-day
14 jours pour
quarantine
protéger leur
to
famille
protect
et la communauté.
families and
Les
communities.
prochains mois seront
The
difficiles.
next months will be
À
hard
mesure que nous travaillons
as we
ensemble pour
work together
maîtriser
to bring
l'activité de la
COVID
COVID
activity
à
under
un niveau
control
qui permettra à la
to a
santé
level
publique de
that will
tester,
enable public health to
tracer
test,
et isoler
trace,
rapidement
and
et
isolate
efficacement.
quickly and
Notre
effectively.
système de soins de santé
Our
est
healthcare
actuellement sous
system is
pression.
currently
Les
stretched,
travailleurs de la
and
santé sont
healthcare workers
épuisés
are
et ont donc
exhausted,
besoin de notre
so they need
soutien.
our support.
À mesure que l'offre de
As
vaccins
vaccine
augmente,
supply
la mise en œuvre
increases,
de la vaccination
COVID-19
contre la
vaccine
COVID-19
implementation
sera l'une des
will be
opérations
one of
les
the
plus
most
complexes de
complex
l'histoire de la santé
undertakings in the
publique.
history of public
Nous savons
health.
que les Canadiens sont
We know
fatigués
that
et que les
Canadians are
mois d'hiver
tired
seront très
and that the
difficiles,
winter months
alors que
will
nous
be very
continuons à lutter
challenging
contre
as
des
we
taux élevés
continue to
d'infection
grapple with the
dans de
high rates
nombreuses
of
régions du
infection in
pays.
many areas
Souvent,
of
la
the
fin de la
country.
course est la partie la plus
Often,
difficile,
the end of
mais
the
elle
race
ne
is the
durera
hardest
pas
part,
éternellement.
but it won't last
Pour
forever.
l'instant, nous
For
devons
now,
redoubler
we must
d'efforts en
redouble
ce
our
moment
efforts at
charnière
this
et
pivotal
en
moment
finir.
and get
Je
this
vous
done.
remercie.
Thank you.
Alors, nous devons commencer avec
So we
deux
will start
questions
with
par
2
le téléphone.
questions on
Et
the phone lines.
on va prendre la première question
We'll
maintenant.
take
s'il
the
vous
first
plaît.
question now, please.
We'll take the first question from the phone.
Thank you, merci. Please press star one at this time if you have a question. S'il vous plaît, appuyez sur l'étoile 1 maintenant pour poser une question. The first question, la première question, est d'Émilie Bergeron, agence QMI. Please go ahead, la parole est à vous.
Oui, bonjour. Une première question sur
Hi,
les
good morning. The
projections.
first question is regarding the projections.
Combien de temps on pourrait attendre
much
avant de
time
voir
could we wait
l'effet des premières vaccinations?
Or do we need to wait before we
sur,
see the
les
impacts of the
projections que
first
vous
dose
faites
of
régulièrement?
vaccines on your regular projections? How long will it take to see the
Merci
effects?
pour la question. C'est Dr.
Thank
New.
you
On est en
for
train
the question. This is Dr. New
travailler
speaking.
avec nos
We
experts
are
de
currently
modélisation
working with
pour
our modeling
peut-être
experts
prédire c'est quoi peut-être l'effet des vaccinations,
to
mais à
predict
date,
what
c'est
the impacts
encore
of the
un projet
vaccination program will be.
en cours.
It's an
C'est
ongoing
difficile parce
project. It is
qu'on voit
difficult
maintenant, même avec
because right now,
peut-être les enjeux avec l'approvisionnement des vaccins, aussi
given
l'administration des vaccins
the administration of the
dans
vaccines,
plusieurs régions du pays,
as
aussi
well as
avec
the procurement
les taux
process,
d'infection qui
and
continuent
also
d'augmenter. Il y a
the
plusieurs
increasing
facteurs à
infection rates in
considérer.
various
Donc,
areas across the
pour
country.
l'instant,
Well,
c'est difficile
there are many
à
factors to
prédire
consider,
exactement
so
quand on
it's
peut
difficult to predict
voir
exactly
un effet
when we will
de
see
la
the
vaccination,
impacts
mais
of the vaccination
on continue
campaigns.
avec nos efforts et
But we
c'est
are
très
continuing our
important de souligner le
efforts,
point
and it's
qu'il faut
important
continuer de
to
suivre les
highlight
consignes de la
the fact
santé
that we
publique
all need to
en
continue to follow
attendant
public
tout le
health
monde notre
guidelines
tour d'être vacciné. Merci.
while we wait for everyone to have their turn at being vaccinated.
My second question is for
Hang on, we're just
Minister
going to have that
Anand.
response repeated in English. Thanks.
Can I?
Okay, yeah. The question was about when we might see in terms of projections with respect to the vaccination efforts. What we can say is that certainly there are experts within the agency and also outside are working in terms of the data to see what effect it might have in the sort of in the mid and long term. But at the present time, it's really difficult to say. There's so many factors involved. Even today, we're seeing issues in terms of vaccine supply, how vaccines are being rolled out across the country. There's other factors in terms of the increasing rates of infection in various parts of the country. So there are many different factors in play. And certainly at this point, it's difficult to say, but we're looking forward to obviously having more data and being able to say something in the future.
Can I just add that what works, and you've seen it in Canada, but in Europe, look at those European countries with the rapidly resurging in cases, the public health measures work. The vaccine in the short term is not going to make any difference to the transmission and that projection. The vaccines are protecting the priority groups right now. So you've seen the graph also with the long-term care facilities. That is why vaccinating this population is of primary importance. That will protect them as individuals who are at the highest risk, and protecting the healthcare workers who support them and who may also be at the risk of transmitting in those settings as well. So that is the effect that we would like to, of course, follow up on first. But in terms of the national projections and the transmission in communities, that is not, you're not going to see that in the initial months. And so, which is why I think our message at the end of our presentation is absolutely get on with the public health measures, do all of those things, don't do non-essential travel. All of that really counts, it works. And when you can suppress that projection, the vaccines have a longer runway, that you're giving them some space for those vaccine programs to be implemented, for the vaccine to begin to work.
Follow up.
Yes, my follow-up is for Minister Anand. I just want to know about the delay you mentioned for the Pfizer doses. Did Pfizer give you an estimated date where we would go back to normal? So in other words, how long could we see some delays in Canada? And do we have an idea of how many doses are affected by this?
Merci beaucoup. Je peux répondre en français si vous voulez.
Thank you very much. I can respond in French if you
Qu'est-ce
would
que vous
like.
voulez?
Oui, s'il vous
What
plaît, en
would you
français.
rather? Yes, French would be great.
Oui, en français, merci.
Merci beaucoup. Oui, merci beaucoup
Thank
pour
you
la question.
for the
Laissez-moi être clair. Il s'agit
I
d'un
want to be
retard
clear.
temporaire et
This is a
non d'une
temporary
perte.
delay
Les vaccins
and
seront
not a loss
livrés
in the
plus
number of
tard.
vaccines we are going
Nous
to obtain.
continuerons
The doses will be
à
delivered a little bit later. We
l'information
continue to obtain
hebdomadaire de Pfizer.
information
Et maintenant,
on a weekly
jusqu'à
basis
maintenant,
from
Pfizer
Pfizer.
parle
And
avec
so far,
le Public Health Agency of Canada
Pfizer has been speaking with the
Monsieur
Public Health Agency
Danny
of Canada
Fortin
and
aussi.
Mr.
Et
Denis
nous
Fortin
allons
as well.
avoir plus d'informations
We will
au
get
sujet
more
de
information
les semaines prochaines.
over the
Et
next
nous
few
allons
weeks,
avoir plus d'informations pour vous
and we
dans
will
les
have more
prochaines
information to
heures,
share over the
je
next few
pense.
hours,
Mais
I
maintenant,
believe.
je veux
For now,
dire que
I
ça
want
c'est
to
temporaire.
clearly state that this is
Nous
temporary.
allons avoir,
We
je
will,
pense, le
I believe,
be obtaining 6 million doses before the end of March, as I already stated, because it's a temporary delay. And over the next few weeks, we will be obtaining more doses
the stoppage in the vaccines
after the
or
stoppage.
the reduced number of vaccines. Donc, je vais parler en anglais maintenant la même
So
chose pour
I'll
vous.
repeat the same thing in English now.
This is a temporary reduction. It's not a stoppage. So we are going to see continued vaccines coming in from Pfizer and, of course, Moderna over the next weeks. But there will be a reduction in doses, and that is the purpose of my being here. It is going to be temporary. It's not a loss, and we will make up those doses. Pfizer has told us that those doses will continue to arrive in greater numbers throughout the month of February and March, so that we are on track for the end of March, as I already said.
OK, prochaine question, s'il vous plaît.
Next question.
The next question, la question suivante est de Mia Robson de Canadian Press. La parole est à vous. Please go ahead.
Yeah, Dr. Tam, you said that if we lift measures too soon, we could see the infection rate just sort of bounce right back. And I'm just wondering, what do you mean by too soon? Do we have formulas or measurements or any idea of where things have to be before you don't think it's too soon to lift some of the lockdown measures that are in place?
Yeah, and those are the same that we've sort of, I think, communicated before. So you need to see your epidemic curve go down consistently and that downward curve all the way to the bottom of that curve, and that you have enough public health capacity set up to do your testing, contact tracing, and isolation. Because when you reach that point in time, you can then see the edges of your outbreaks and begin to be able to manage them. You've seen that in some of the provinces with the lower number of cases, when you can see where they are and maybe their outbreaks and such, you can rapidly test and reduce the further spread. So breaking those chains of transmission is very difficult to do when you've got so much community transmission going on. So that would be a really critical sort of indicator for sure. And because in so many areas of the country, the virus is spreading in the community, the moment that you lift some of those or increase contacts, basically, for individuals, it's expected that the virus will surge. So getting that capacity there is very important. Of course, provinces are also tracking their hospitalizations, ICU admissions in terms of keeping the activity down below the capacity to cope for the health system as well.
Thank you. And I'm also curious with the new variants that we're talking about and the suggestion that they are more easily transmitted than what we've seen to date. Just wondering if that's been taken into account in the modeling numbers at all. If we'll only mark, I think, 22 of cases of those variants, but likely there are more. And if we have included that in our modeling at all.
Not in what I've shown in these slides, but yes, modeling has been done on looking at, so basically you're making some assumptions on the reproduction number, for example, and expanding that. And that modeling has been done in our scenarios. And I believe those get posted on our website on a consistent basis. This is what the modeling working group is doing. But essentially, yes, will be the answer. We're modeling the impact of variants. And I think, not surprisingly, if you have a variant that's more transmissible, there is definitely a risk of resurgence, for which the measures, although they're the same, really the same public health measures, need to be that much more stringently applied in order to get those kind of resurgences under control.
Oui, Nous sommes toujours en train
Yes.
utiliser aussi les données avec les
always
variants dans
using
nos
data
efforts de
on the
modélisation.
variants
Et
in our modeling.
je peux dire que oui, ça fait partie de nos
Yes, I
analyses.
can say that it is being included in our analyses.
Quoi d'autre?
What else? Inaudible to the interpreter, question from the journalist in the room.
Oui, actuellement, avec le
Currently,
nombre de cas avec les variants signalés à date,
with the
on utilise ça
variants,
pour
the number of
nos
cases of the
projections à date,
variants
mais
that
au
we've
fur
heard
et à
about so
mesure qu'on
far,
reçoit peut-être
well,
d'autres
we are
données,
using
on
those
va
numbers
intégrer
in our
les autres
modeling,
données
and
dans
as
nos
we get
analyses,
more data,
modélisations
we
au
will
futur.
include
So
them in
this
our
is just
analysis and
modeling
future
data.
modeling.
What we have asked for, though, is any time there's a uptick in numbers, for example, I would say New Brunswick. New Brunswick has had more cases. So those get sent to the National Microbiology Lab for sequencing. Because what you want to say is, well, is it we do have epidemiologic data at the local level. So actually, someone had an event or someone had, they could trace those kind of clusters. At the same time, you still want to analyze the genetics just to see if that's contributing. And we have not found that, for example, in that setting. So that's part of the genomic testing strategy. So at the moment, those sequencing is ongoing to look at three really fundamental ways of looking at the impact of the variants. One is more widespread, general sampling for looking at the genetics of the viruses around. Two is more targeted, for example, for travelers and for certain super spreading events or certain outbreaks or people who have reinfection. We would definitely want to sequence people who may have an infection after they've been vaccinated. So there's a sort of strategy in place to look for any introduction or the potential impact of the variants.
Je peux répéter en français. Actuellement, on a comme un système intégré de surveillance pour détecter les variants avec notre laboratoire national microbiologie à Winnipeg, aussi avec leurs partenaires des provinces et territoires et aussi des autres intervenants. Il y a comme trois points avec notre surveillance. C'est sûr, on peut-être d'une façon pas aléatoire, mais on prend aussi avec notre système de surveillance en général. On continue de prendre quelques échantillons pour faire le séquençage génétique, mais de plus aussi pour les événements, s'il y a un cas avec beaucoup de contacts aussi exposés aussi, qui sont devenus après des cas, comme dit super spreading event, c'est sûr aussi
for example, look at super spreading events. We ask for samples from those events to do genetic sequencing. And when people and travelers arrive in Canada from outside the country, if they test positive for COVID-19, we do test for the variant as well. And there are certain other situations as well. If there is any activity that's a little bit more suspicious, of course, the laboratory and our partners will conduct the analysis. Dr. Tam
peut-être une première dose de
vaccin
de COVID-19.
Looking into cases where people got the first dose of the vaccine
avec la COVID-19, on va aussi
to see whether, if anybody catches COVID-19 after that, we will be looking at the genetic sequencing as well to see if there has been an impact
On va prendre des questions de la
variants.
salle.
We'll take questions
from the room. Go ahead, David.
Hi, David Thornton, CBC News. Minister Anand, good morning. The first question I just want to ask you is that Major General Danny Fontaine said that we should expect to see on a weekly basis, about 208,000 Pfizer doses coming into the country for January. So I'm just wondering, for provinces, for Indigenous communities, the few that can take this vaccine, and even people in long-term care homes and doctors who are desperate to get this vaccine, should they be prepared to see less of what was expected to come into the country given this new development with manufacturing?
Thank you so much for the question and good morning. At the current time, my knowledge is based on my conversation with Pfizer as of last night, and I have given you all that I know. I am aware at this morning that Pfizer is speaking with the Public Health Agency of Canada to further provide information relating to the numbers over the next weeks so that planning can take place. And I believe that there is a press conference later today, and hopefully those numbers will be available. But the purpose of the meeting last night with Pfizer, I believe, and me and my department was to provide the information that there would be a reduction of the doses that would be delivered to Canada in the very short term, but that we would be making up that pace of delivery by the end of Q1. We still anticipate getting a total of 20 million doses in Q2 from the currently approved vaccine manufacturers. We still anticipate being on track to vaccinate all Canadians who wish to be immunized by the end of September via approved vaccines. And so, as I have reiterated, this is a temporary issue in terms of the reduction of doses, but that pace will pick up towards the middle and end of February and into March, and we are on track for Q2 and the rest of the year. Thank you.
Okay, just totally different question. Dr. Tam, I just wanted to get your take on what the BC's Premier John Horgan said yesterday, that they're considering their legal options. What are their options when it comes to closing their borders to reduce the amount of infected people that are coming in, adopting a similar approach that the Atlantic provinces have adopted. Can you tell us, do you think that this is a good idea? Should we see a BC bubble? And if you can't be as definitive, because sometimes you aren't, what are the challenges? What are the positives of having these sort of provincial bubbles or restrictions?
I think fundamentally the public health measures are there to reduce contacts and spread. So anything that can reduce the number of contacts people have with each other is one of those measures. So reducing importations from other areas of Canada is, one way of looking at it. So that is what the province is looking at. You've seen very regionalized approach. You've seen the territories taking into account their own context and set of circumstances as to what they may need to do. So I'm sure it's a very difficult, decision. But I think the general message is, though, even domestically, try not to undertake non-essential travel is actually important, not just for the international context at the moment. I think for now, if you're vacationing, and traveling across Canada, this is not the time to be doing non-essential travel. You've seen the provinces of Quebec and Ontario looking at reducing the mobility of the population by their public health announcements. So the whole concept of reducing contact is basically what you're talking about, and people are looking at different ways of doing that.
Oui, l'enjeu du voyage ou du déplacement des personnes entre les provinces, je pense, pour moi, en fin de compte, c'est vraiment peut-être un enjeu pour souligner le point à tout le monde. C'est très important de limiter, de peut-être éviter les voyages n'importe où non essentiels.
Non-essential travel anywhere.
Même dans la province de
Just to add to what Dr. Tam was saying, just within Ontario, the message is stay at home, not travel from one city to another. We could talk about interprovincial travel, but it's the same thing within any given province. Whether it's in Ontario or Quebec, that's the point we're trying to drive home.
Des provinces et territoires, c'est vraiment de limiter
le déplacement
des personnes.
Of the provinces and territories to limit the movement of people. But what I can say is just to highlight the point that Dr. Tam and all public health officials have said for many months now: limit contact, stay home.
Okay,
Laurence Martin, Radio-Canada. Ma première question est pour la ministre Anand. Je comprends qu'on a encore peu de détails, mais j'essaie juste de clarifier. On parle d'une baisse de production ou de retard de livraison pendant combien de semaines? Est-ce que c'est jusqu'à la fin janvier, jusqu'à début février? Et on parle d'une baisse d'environ combien? De 25 50 75 des doses qui étaient attendues? Est-ce qu'on peut avoir quand même un ordre de grandeur?
Also, how long will this delay last?
Minister Anand?
Yes, I'm here, but I can't hear the question anymore.
Okay, let's repeat that.
Je vais juste répéter la question. Je voulais juste clarifier pour les retards là, dans les livraisons de Pfizer. Est-ce qu'on parle de retard de quelques semaines? Ça va durer combien de temps ces retards? Est-ce qu'on parle de retard jusqu'à la fin janvier, jusqu'en début février? Et on parle grosso modo là, d'une baisse de production de 25 50 75 de ce qui est attendu, juste pour nous donner un ordre de grandeur.
Merci beaucoup. Comme j'ai déjà dit,
thank you very much. As I already stated, we will be obtaining more information
les chiffres,
with more numbers, but it is a temporary reduction.
Déjà, entendre de Pfizer
we already heard from Pfizer
le livraison
that
vont être en retard.
The vaccine deliveries will be delayed by perhaps 2 or 3 weeks, not a very long time at all.
Je ne sais pas maintenant le montant de la réduction, mais
and I don't know how much their production has been decreased by, but I will be obtaining that information. We will be obtaining it. Today, I hope.
D'accord, merci. Et mon autre question est pour vous, Dr. New. Je me demandais, on voit vos prévisions, elles ne sont pas très encourageantes, plus de 10 000 cas d'ici la fin janvier. Jusqu'à quel point est-ce que ce qu'on voit maintenant, c'est causé par l'arrivée des nouveaux variants? Ou peut-être les gens qui n'ont pas respecté les consignes dans le temps des fêtes, parce que là, on est 2 semaines après Noël, on commence à voir les impacts. Qu'est-ce qui cause cette augmentation selon vous?
Pour moi, selon les données ce qu'on a reçues, c'est vraiment une question que les gens peut-être ont eu plus de contacts. On parle aussi des fêtes, on a vu que l'augmentation des taux d'infection, c'est vraiment après le congé des fêtes.
In the number of infections after the holidays. That's why Quebec, Ontario, and a number of provinces are seeing that they now have to put in place stricter public health measures, as we've seen in Quebec with the curfew. The introduction of the variant is a factor, perhaps. It could be a factor in the future because it does make the virus more transmissible. But really, it again highlights the point that we need to continue to implement our public health measures. It might be even more important to do so with the variant, but it's the same things we've been saying for months. You know, wear a mask, ensure social and physical distancing, and so on. We see that Canadians are tired. They
Je sais, moi aussi, c'est
difficile.
Et maintenant, janvier,
want to follow the public health measures. And it's the same thing. Of course, we understand our winter is long, it is difficult. It's the month of January, February, but we need to continue with them. The vaccines are a beacon of hope, but they're not going to have any kind of immediate impact. Vaccines are for the long term. Right now, our healthcare systems are at a critical point. They are being overloaded. So we need to take immediate action.
Okay, Marika, go ahead.
Hi there, Marika Walsh with the Globe and Mail. Good morning. Just a question for my colleagues, for Minister Anand. Drug makers, including Pfizer, have said that access to COVID-19 vaccines came up in their discussion with your government about the new regulations to reduce drug prices. Did Pfizer, Moderna, or any vaccine producers threaten to withhold COVID-19 vaccines from Canada if the new regulations came into effect? And did the government delay the new regulations because of concerns over access to the vaccine?
Thank you, Marika. Not at all. The issue did not come up in terms of my conversations with the drug makers. I've had no conversations relating to the implementation of the regulations that you refer to at all in those conversations. And I haven't been involved actually in terms of those decisions with Minister of Health at all.
Okay, thank you so much for the direct answer. My next question is for Dr. Tam or Dr. New. I'm just wondering, given the modeling we're seeing, given that it's now, the new projection is 10,000 daily new cases by the end of January, it was previously predicted that if we maintained contacts, it would be 10,000 daily new cases by the end of December. So does that actually mean that people have actually reduced their contacts a bit, at least, that it has slowed since the projections from November? Or is that not the right interpretation?
I think our projections were going the right direction ahead of Christmas. In fact, we give intermittent updates, and when we said 10,000, it actually went down a bit, the projections, as the epidemic curve, as you've seen, leveled off for a number of days. But now, after the holiday period, we're seeing this surge. The projections are going up again. It will come down again, by the way, if people working together with public health do reduce their contact. Our next set of projections could be lower. And so it's all sort of fluctuates and dependent on what actually happens in real time, basically. But yes, it did swing into the better space, and then now it's swung the other way.
Okay, we'll go back to the phone for two further questions. Start with first one.
Thank you. The next question, la question suivante est de Catherine Levesque, La Presse canadienne. La parole est à vous. Please go ahead.
Oui, bonjour tout le monde. Je vais aller
Good
dans le
morning,
même sens
everyone.
environ que ma collègue Mary-Kay Walsh.
It'll be
Dr.
a
New,
question in the
justement,
same
elle l'a mentionné
vein as
lors
my
de la dernière
colleagues.
modélisation.
Dr. New,
Justement,
you
il était prévu
mentioned
qu'il y
that
ait plus de 10
during
000
the
cas
last
par
set of
jour. Là.
modeling, it
Et
was
là, vous,
predicted that we'd see
d'un
more
côté,
than
vous
10,000
dites
cases
qu'il y a eu
per
plus
day,
de
and now you're
contacts
saying
que les
that
gens
there was
ont
increased
laissé tomber leur
contact, that
garde pendant les fêtes.
people let down their
Mais en
guard
même
over the
temps, on voit
holidays, but at
que
the same
vos
time, we can see
projections,
that your
finalement, aujourd'hui, sont
projections
les mêmes qu'au mois
today
de
are the
décembre.
same
Alors, je
as
me demandais
those
finalement,
in
est-ce que
December.
c'est une nouvelle
So
positive aujourd'hui? Les
is
gens,
that
est-ce qu'ils ont
positive
effectivement
news?
réduit leurs
Did
contacts
people
vu que les
actually reduce
projections
their
sont
contacts
moins
since the
pires que prévu au
projections
final?
are not as bad as we thought in the end?
OK, merci pour la question. Je
Okay,
pense
thank you for
que
the
j'ai même
question.
réponse que Dr. Tam, que
My answer will be the
peut-être
same as Dr. Tam's, I
dernière
think.
fois, on a fait une séance d'information avec les
Last
projections.
time,
On était
we
dans
had
un meilleur
an
espace. On peut dire que,
information
OK,
session with
peut-être les
the
projections,
modeling. We
on
were
dit
in a better
peut-être
space
on va avoir
that
moins de
is in a
cas
better
peut-être
position.
par
That
jour.
is, we
Mais
may
maintenant,
see
après les fêtes,
fewer
on
cases per
commence. Mais
day,
c'est
but
sûr parce que
after the
peut-être
holidays, we're
on va
starting.
recevoir encore
I mean,
des autres cas signalés dans les
we
prochains
might
jours et semaines. Mais
we'll be hearing about further
toutes les
cases over the
indications
next few days
que
and weeks, but all the
les
indicators,
fêtes, le temps des fêtes,
all
les
that are
rassemblements, les
that
personnes
gatherings over the
ont peut-être eu
holidays
plus de contacts
meant that people had
qu'avant.
more contacts than
Maintenant, on voit les
before,
résultats. Et c'est
and now
pourquoi
we're
je
going to
pense aussi
see
que les
the
gouvernements de
impacts.
plusieurs provinces, comme le
That's
Québec et
why
aussi en
the
Ontario,
governments of a number
ont
of
commencé
provinces, such as those of
avec
Quebec and Ontario,
des mesures plus restrictives
have
ou
started
comme un
putting in
couvre-feu
more
au Québec.
restrictive
Et
measures,
c'est
such
à voir
as
c'est
a
quoi le
curfew in
résultat
Quebec.
des mesures maintenant en
So
vigueur.
we'll have to see what the
Je
results
pense pour
of
le
the current
Québec, le
measures
couvre-feu,
will
c'est
be.
jusqu'au début du mois de février.
The
Et on
curfew in
espère pour le
Quebec
Québec
will last
qu'avec
until
le
the beginning
couvre-feu et
of
les
the
autres
month of
mesures,
February. We hope that with the other
les
measures,
personnes, je pense,
including the
prendre au
curfew,
sérieux qu'est-ce
that
qui se
people
passe
will really
actuellement.
seriously
Je peux peut-être
consider
souligner pour
what's
le Québec,
happening right now.
je suis en contact avec mes homologues de Québec et ils sont
I
vraiment
am in communication with my counterparts in
découragés,
Quebec.
épuisés.
They are
J'ai
exhausted,
vu aussi plusieurs
discouraged.
entrevues avec les médecins du
I've seen many
Québec,
interviews with doctors in Quebec,
dans les salles d'urgence,
in
des soins
emergency
intensifs,
rooms, intensive
aussi
care
le
units,
personnel de santé publique. Tout le monde a
and
travaillé très fort
healthcare staff.
depuis,
They have
c'est
worked
presque un an, c'est le
so
mois de janvier
so hard
2019.
for the past
On est
year almost.
2020, on est 2021 maintenant.
Since
J'ai oublié aussi, mais avec
February,
le
March
temps,
2020.
quelle année, mais c'est vraiment
That's right,
quelque chose
2020. I'm
très
mixing
grave
up my years.
maintenant.
But this is, we're really in a serious
On doit
situation
souligner
here.
le point que
But I really need to highlight the point that we're all in the same boat. It's not just governments, doctors, public health agencies. It's teamwork that we need, working together with everybody. Thank you.
OK, merci beaucoup. Et ma question
Thank you.
c'est
And
pour Madame
my
Anand.
follow-up question is for Ms. Anand regarding the Pfizer information. I understand that there will be more information coming in the next few hours. However, could you tell us whether all countries will be impacted by those delays? Will all countries be equally affected? For example, will Israel see the same delay or decrease, or do you have any information that might indicate that Pfizer might be concluding agreements with various countries depending on who's a priority? Thank you very much for the question. I understand that Pfizer will be dealing with all the countries that have ordered doses.
In other words, I understand from my discussion
that they'll be treating them the same.
That all countries that are receiving doses from Pfizer's European facility will be equitably treated in terms of the reductions. In terms of specifics about how each country is going to be treated, of course, I don't have that information, but they mentioned to me in my conversation that they are very concerned to make sure that countries are fairly treated across the board in terms of the temporary reduction that is being faced. I want to reiterate, though, that we do anticipate making up those doses in Q1. We do anticipate having millions and millions of doses from both Pfizer and Moderna coming into this country in Q2, as I've already said.
It's very important to remember that Canadians will have access to the doses of the Moderna and Pfizer vaccines before the end of the second quarter and during this third quarter as well. We will have enough vaccine doses for all Canadians who wish to be vaccinated by the end of September, and we will receive a combined total of 90 million doses from Pfizer and Moderna by the end of the year. So it's very important to remember that. Thank you.
Okay, we'll take one additional question from the phone.
La question suivante. The next question is from Steve Shear with Reuters. Please go ahead. La parole est à vous.
Good morning. I wanted to ask about the difference between the federal recommendations on the interval between the two shots and that in Quebec. So Quebec says they may space out the doses for the vaccines by 90 days, but it was 42 days was the federal recommendation. I guess I'm wondering if do you think it's okay to extend it for more than 42 days, and what is your message to Quebec?
It's Dr. New here. Maybe I can start. So certainly what you're referring to, the National Advisory Committee on Immunization, is a national body. It's a committee that reports to the Public Health Agency of Canada with experts throughout the country. So based on their analysis of the available data of the two approved vaccines, they're looking at the dosing intervals of 21, 28 days for the two vaccines, Moderna and Pfizer, and what's available. They looked at the data, as also has the expert committee that works for the WHO, and based on the available data, they determined that the dosing interval, under exceptional circumstances, could be extended up to 42 days based on the available data, and that there should be no drop-off or loss in terms of the efficacy of the vaccine. So that is the data out there. That is a recommendation, but there's also the acknowledgement by NACI that provinces and territories will have to take that into account, their own exceptional circumstances, whatever they may be, the epidemiology, supply management issues, etc. And so my understanding, and I can't speak for Quebec, is that Quebec's own immunization committee, probably looking at some of the data specific to Quebec in terms of its epidemiology and the other factors involved, took that into account in terms of whatever its determination and recommendation to the government of Quebec. So that is unique to the Quebec situation, and that's why it may in some ways be somewhat maybe different in some respects to what has been put out by NACI. I'm not sure, Dr. Tam, you would like to add anything?
No, just so that there is a commitment to collect data in real time for any extensions of that interval. So I think that's really key, because then you can actually assess the vaccine efficacy or vaccine effectiveness really in real time, and share that with with others. That's really key. But I don't have anything else to add to what Dr. New has just said.
Steve, follow up.
Yeah, I guess my question would be, are you concerned that Quebec is being forced to delay that second dose for much longer than the recommendation coming from I can't remember the name of the group now, but they are extending it much longer, and is that concerning for you guys? And do you think that that provinces should try to follow the guidelines, or is it acceptable that they extend these the delay between the doses, given the scarcity of the vaccine right now?
So I think the Chief Medical Officer of Health have put out a statement, and following the NACI statement, and in support of what NACI has said, and that's what Dr. New had expressed. And collecting any information, collecting data for any extension of that interval is really critical. The bottom line, though, is as the experts look at the data, you also take into account past experiences with vaccines that are given in serial intervals. So some of the considerations are the fact that that interval, that 4-week interval, is quite a short interval when you actually think about how vaccine doses that are given in multiple doses are normally given. But that is the limitation of the clinical trial and the interval that they've set in the trial. But in terms of how vaccines normally work, they are often given intervals much longer than this 4 weeks. So I think that's how some of the Quebec deliberations have been. What I would suggest is that I think it's important for that cohesion, but it's also important for us to keep looking at the data, because we will also have international data from Israel or from the UK or from any other place, from the companies themselves, and that we must be able to sort of adapt our immunization approach as the data is presented as well.
Dernière question de la salle.
De nouveau, Laurence Martin, Radio-Canada, par rapport à l'impact du vaccin sur la modélisation. Je sais que vous avez dit au début de la conférence de presse que c'était encore tôt pour le dire, mais juste pour les gens, est-ce qu'on parle d'un impact qui pourrait se faire sentir vers la fin du printemps, vers le début de l'été, dans le courant de l'été, selon vous? Étant donné que l'objectif, comme l'a dit Mme Annan, ne bouge pas, là, on veut toujours vacciner tout le monde d'ici la fin septembre. À partir de quand est-ce qu'on pourrait sentir l'effet du vaccin sur les chiffres?
Ce que je peux vous dire, c'est oui, c'est sûr que c'est une lueur d'espoir avec la vaccination, mais pas pour vous dire qu'avec une certaine date, on peut voir un effet, parce que
we won't be able to
nos
say
experts
that we'll be able to
au sein
see
de
an
l'agence, on a
impact
eu des
by a
discussions.
certain date.
Et
Within the
je pense
agency,
que
we've
la
been holding many
préoccupation,
discussions,
la
and
crainte, c'est
the
que
concern
tout le monde pense que
in
c'est
the end is
avec
that,
la
well,
vaccination, ça va être
vaccines
la
have come in.
solution.
Everybody will
Et non,
say
parce que
that's a
si on
solution,
continue pas
but that's not the
avec les
case,
bonnes
because if we don't
pratiques de santé
continue with
publique,
good
on
public
va
health
aucun
practices,
effet
there will
avec la
be
vaccination. Donc,
no
je pense que
impacts
on voit actuellement
from the
qu'est-ce qui se
vaccine.
passe au Québec,
We
en
can see
Ontario,
right
dans
now what's
plusieurs
happening
régions
in
du
Quebec and
pays.
Ontario,
Je
many
pense
regions
que
across the country.
il faut aussi suivre qu'est-ce qui se passe
We also need
avec la
to
population, aussi les
see
autorités
what's
de santé
happening
publique,
within the
avec les mesures
population,
pour voir
with
c'est
the
quoi le
public
taux
health
d'infection,
agencies,
avec
to
le
see what
nombre
the
de
rate of
contacts,
infections are, the number
les
of
personnes
contacts
les uns avec les autres.
between
Actuellement,
people
la
right now.
vaccination, on commence avec les groupes prioritaires. C'est
We
très
are
important
starting
pour
with
les
vaccines of
protéger.
priority groups. That's
Mais
very important for
pour
protecting them.
vraiment avoir un effet à l'échelle
to
de
really
la
see
population, c'est vraiment
A
difficile ce
change
point-là.
at the population level, it's really difficult to predict. I want to add something.
Par exemple,
For the first quarter, for example,
ça va vraiment important de
it will be very
suivre
important
la projection pour, par exemple,
to monitor the
la
projections,
mortalité.
for
Parce
example,
que
for
le
mortality,
premier groupe
because
pour
the
le
first
vaccin sont les personnes âgées, les personnes
group
dans les,
receiving the vaccine is
soins de longue durée. Donc,
elderly
c'est
people,
peut-être le
people in long-term
premier,
care homes. So that may
signe,
be the first sign
pour signaler l'efficacité du vaccin. So
that would signal the effectiveness of the vaccine. So perhaps
sera
looking at that
changée.
projection
Mais il n'y a
would help, and
pas
that projection will be
suffisamment
reduced.
de données
The numbers will be
concernant
reduced, but there is
l'efficacité
not
du
enough
vaccin
data based on
pour
the
réduire la
effectiveness of the
transmissibilité
vaccine in reducing the
de
transmission and the
Donc, on
transmissibility
va
of
avoir plus de
COVID-19.
données,
We will
à
have more
venir,
data in
dans
future.
les mois prochains. L'autre observation
Now, the other
importante
observation,
est dans les autres pays aussi pour partager les
from what
données
we've
avec
seen
les
in other
homologues
countries, and
internationaux.
to share information with our international
donc,
counterparts.
Il y a des
Well,
connaissances concernant la transmissibilité,
there is knowledge
l'efficacité
and data
et
regarding
durabilité
the
vaccins aussi.
transmissibility,
Donc,
the
les deux
effectiveness,
facteurs sont très importants
and how to
pour
reduce
notre
that
projection. Mais pour les
transmissibility.
modélisations, on peut ajouter
That's the information we're waiting for. It's very important for our projections, but
de données, c'est juste,
we have
juste
all kinds of data. We are adding yet more to try to get a more accurate
Et donc, est-ce que,
idea
selon
of
vos
the
projections,
situation
selon
for
ce que vous
public health
voyez,
measures.
vous
Now,
prédisez
based
que,
on
par
your
exemple,
predictions,
à la
on
fin
your
mars,
projections,
on va voir le taux de
are you
mortalité
thinking that there will be
baisser?
a decrease in the mortality rate by the end of March, let's say?
Je peux dire que
Well,
ça peut-être
I can
un
say
effet, mais pas totalement. Parce
perhaps,
que si
but
le
not
taux de
completely,
transmission dans la
because if
communauté
the
est
transmission
toujours
rate is still
haut,
high in the community,
c'est vraiment difficile
it's
de
very
passer,
difficult
les impacts,
to
dans
assess
certaines
the
populations.
impact in
So,
certain
Donc, on
populations.
va voir comment déjà
So we'll
dit,
see,
c'est une combinaison
like we've already said, it's going to be a
de
combination
stratégies pour
of
réduire,
strategies to
le taux
reduce
de l'épidémie.
Okay, we'll have to end the
epidemic
press conference
rates.
there. That
I
concludes the
think
press
our
conference.
model suggests that you can't just have vaccines. Right? We don't know enough. We don't know about enough about transmission. If your community transmission is still high, you can't. The vaccines alone is not going to make a dent in some of that. But we would love to see, as the older population and long-term care receive the vaccines, that we're going to look very carefully to see if the serious illnesses and the deaths go down. But that's also a factor of what's happening in the community. You've seen how that goes up and down as a result of community transmission. So teasing out the effect of the two would be an interesting thing that we need to analyze.
Can you just clarify really quickly if the Ontario new stay-at-home order is factored into these models? Like when you say in the appendix that they need stronger measures, does that appendix factor in Ontario's stay-at-home order? Like, is more needed than the curfew and the stay-at-home order, or are those not factored in?
What the models do is numerous bits of public health measures. They throw in every layer. We talked about this.
Those things.
It includes a range of reduction in contacts, however you do that. So
my question is, your last slide shows that stronger health measures are needed. When they say stronger health measures, is that based on these? Is that already factoring in the Ontario shutdown or stay-at-home order?
The projections. Let me see the date. 9th of January, so no. But if you see the blue line, the forecast to suppress that curve, that takes into account the amount of contacts. So, but no, so the date we can verify. It should be at the bottom of the slide, I think. Sorry? That is what we hope. And yeah.
Okay, thanks, folks.